Hi friends, welcome to the world of microbiology. In this video, we will discuss the topic Mycobacterium kansasii. Let us discuss the general characteristic of Mycobacterium kansasii. Its Gram's classification is gram-positive bacterium. Its shape is bacillus, which means rod. Motility is non-motile. Capsules is absent in Mycobacterium kansasii. Endospores are absent. Its mode of respiration is aerobic. Optimum temperature is 35 to 37 degrees Celsius. Optimum pH is 6 to 7.5. This bacterium was discovered by Elizabeth and Charles O. Jacobson in 1979. Let us discuss the pathogenicity of Mycobacterium kansasii. It is a non-tuberculous bacteria. Mycobacterium is typically transmitted through inhalation of aerosols containing the bacteria. Infections may commonly occur in individuals with weakened immune system, but transmission can also happen in healthy individuals. Avoiding exposure to contaminated water resources and minimizing close contacts with infected individuals can help reduce the risk of transmission. Let us next discuss virulence factors of Mycobacterium kansasii. It includes its ability to resist host defenses such as the capacity to survive within macrophages. It possesses cell wall components like mycolic acids which contributes to its pathogenicity. The exact mechanism of virulence are complex and may involve interactions with the host immune system. Its incubation period is 15 days. Next, we will discuss the pathogenesis of Mycobacterium kansasii. The pathogenesis of Mycobacterium kansasii involves several key steps. Inhalation and entry is the first one, which means infection typically begins with the inhalation of aerosolized Mycobacterium kansasii from the environmental sources such as soil or water. This bacterium entered the respiratory system. And the second one is alveolar macrophage invasion. In this, Mycobacterium kansasii has the ability to invade alveolar macrophages, the immune cells responsible for clearing pathogens from the lungs. And the third one is granuloma formation. The immune response is activated, leading to the formation of granulomas, organized collections of immune cells attempting to contain the infection. Mycobacterium kansasii can persist within the granulomas, contributing to chronicity. And the last one is cell mediated immune response. The host's cell mediated immune response, particularly T cell activation, plays a crucial role in controlling the infection. However, in individuals with weakened immune system, such as those with HIV, AIDS, or other immunocompromising conditions, Mycobacterium kansasii infections can become more severe. Next, we will discuss the clinical manifestation of Mycobacterium kansasii. Infection primarily affect lungs, causing symptoms such as cough, fever, and weight loss. Disseminated, though rare, may occur in immunocompromised individuals, affecting multiple organs. Clinical manifestation of Mycobacterium kansasii infections often resembles those of tuberculosis. Common features include respiratory symptoms and the severity can vary. Typical clinical presentation includes first one is pulmonary infection. In this, Mycobacterium kansasii commonly cause lung infection leading to symptoms such as chronic cough, sputum production, hemoptysis, which means coughing up blood, chest pain, and fatigue. And the next one is cavitary lesions. Some cases may involve the formation of cavities within the lung tissue similar to tuberculosis. And the last one is disseminated infections. While less common, Mycobacterium kansasii can disseminate beyond the lungs, particularly in individuals with immunocompromised immune system. This may lead to systemic symptoms including fever, weight loss, and involvement of other organs. Next, we will discuss the laboratory diagnosis of Mycobacterium kansasii. It involves several methods to identify and confirm the presence of bacterium. Common diagnostic approaches include microscopic examination. In this, acid for staining is performed on clinical samples such as sputum or respiratory secretions. Mycobacterium, including Mycobacterium kansasii, retain the stain and appear as red or pink rod under a microscope. Next one is colony on culture medium. Clinical specimen are cultured on specific media such as Leunston Jensen or Middlebrook agar to isolate and grow Mycobacterium species. Mycobacterium kansasii typically grows slowly and cultures may take several weeks to show visible growth. And the next one is molecular techniques. Polymerase chain reaction assays can be used to detect specific DNA sequences of Mycobacterium kansasii. This method provides a rapid and sensitive means of identification. And the last one is immunological tests. Serologically tests such as immunochromatographic assay or enzyme linked immunosorbent assay, which means ELISA, may be used to detect specific antigens associated with Mycobacterium kansasii. Once the bacterium is isolated, the additional tests may be performed to determine drug susceptibility, guiding the selection of appropriate antibiotics for treatment. It is important to note that combination of these diagnostic methods is often used to achieve accurate and reliable results in the identification of Mycobacterium kansasii. And finally, we will discuss the biochemical tests of this bacterium, Mycobacterium kansasii. In this, urease test is positive, catalase test is positive, nitrate reduction test is positive, and finally RL sulfate test is negative. And now we will discuss the treatment for the infection or disease of Mycobacterium kansasii. The treatment of Mycobacterium kansasii infections typically involves a combination of antibiotics. The choice of antibiotics is based on drug susceptibility testing, which helps identifying the most effective medications against the specific strain. Commonly used drugs for Mycobacterium kansasii includes isonic acid, first one, often a key component of the treatment regimen. And the next one is rifampin, another important antibiotics often used in combination with isonic acid. And third one is ethambutol, frequently included in the initial phase of treatment. And the last one is clarithromycin or azithromycin. These macrolide antibiotics are sometimes used particularly when there is resistance or intolerance to other drugs. And finally, we will discuss the prevention and control methods of this Mycobacterium kansasii. Preventing and controlling Mycobacterium kansasii infections involves a combination of public health measures, infection control practices, and individual precautions. Thank you, friends.